delight to be here. I love this place. We enjoy coming here with our medical students, and it's really a pleasure to address this topic. While I am very committed to the Healthy Aging Initiative and hope everybody participates, I'm not going to tell you about that study per se, but I'm going to provide sort of a freebie of additional education just about cardiovascular risk so that everybody can try to prevent cardiovascular disease. So that's my title, Reducing Cardiovascular Risk, and I'm focusing on older adults, which I think we all are, myself included. Let's take this and try to make it an open discussion at the end so I can address some of your questions. So what is cardiovascular? What do we mean by the cardiovascular system? And one of its components, which is atherosclerosis. Well, shown here on this slide in the middle is a human body. Let me see if I have a pointer. There we go. That illustrates the cardiovascular system. And of course, as you know, it consists of the heart and all of the blood vessels that come out of the heart, called the arteries, and then the blood vessels that return blood to the heart, called the veins. And we need this system in order to get blood to all of our vital organs. We need to get blood to our brain, to our heart, to our lungs, our kidneys, our muscles. Every organ in the body needs blood. Why does it need blood? Because it gets oxygen and sugar and nutrients from the blood. So we have this pump that's constantly pumping throughout all of our arteries and smaller vessels and smaller vessels still to get every cell in our body nourished with oxygen and sugar. But over time, most of us, in fact almost all of us, develop atherosclerosis, which means hardening of the arteries. And shown here on this slide on the right side is an example of why the arteries harden with age. On the top is a normal blood vessel, an artery, and here blood can flow unimpeded. It just is a tube, like your plumbing, and it runs right through and goes to every organ in the body. But these vessels can sometimes constrict, and that's shown in this next little picture here. They can also develop this yellow stuff. I call that schmutz, but it's really cholesterol that deposit in the arteries and narrow them. And then finally, in very severe situations, blood clots form on top of this cholesterol and prevents blood from flowing. If you get hardening of the arteries of the heart and blood clots in those, what happens to you? You get a heart attack. If you get hardening in the arteries in the brain from cholesterol and then a blood clot on top of that, what do you get? Stroke. Yeah, a stroke, and that can really cause severe damage and disability. So our goal is to prevent the cholesterol from depositing in our arteries and prevent the blood clots from forming in the first place. So let's talk about how we can do that. We do that by thinking about cardiovascular risk. What are the risk factors in our lives? But first, what do we mean by cardiovascular risk? It's the risk of having a bad thing happen. When doctors say you're at high cardiovascular risk, what do they mean? They mean you're at risk of having a heart attack, or having a stroke, or having heart failure, or having diseases of the arteries, usually in the legs, in the abdomen, in the kidneys, or the heart, or the brain. And of course, you're at risk of death. So we want to reduce cardiovascular risk. Another way that doctors talk about it is ASCVD risk. You know what that stands for?
The chance of getting it in the next 10 years.
Well, yes, but ASCVD means atherosclerotic cardiovascular disease. So it's atherosclerosis and cardiovascular disease. So when your doctor says, oh, you have a high ASCVD risk, that's what they mean, okay? So what are the cardiovascular risk factors? This is really important stuff. There are 10 cardiovascular risk factors. And we want to identify them and make sure you don't have any of them. And some of them are preventable or reversible, and I'll talk about how we do that. But here they are. The first is unhealthful nutrition. McDonald's, that's probably the biggest offender.
Excuse me, could someone turn off the lights? They're glaring on
Oh,
the
it's
screen.
glaring? Well, I don't know how to do that, but maybe somebody
I
can.
don't know how to get over there.
Somebody's got
We got it right back in the
Thank you.
room.
There you go.
Is that too
Thank you.
dark? Don't fall
No,
asleep.
that's
on me.
good.
Okay.
Nice work, Steve.
So, unhealthy nutrition, physical inactivity. We know that that's dangerous, and all of us do it. I mean, here we are, sitting in lectures, or sitting around watching television. We need to get up, and we'll talk about how to do that. High cholesterol. Many of us have high cholesterol, but again, that's treatable, and we'll get to that. High blood sugar, also known as diabetes. High blood pressure, that's perhaps the most common and most treatable risk factor for cardiovascular disease. Overweight and obesity, shown on the top right here, over there. And then certain populations are at higher risk. For example, older age. The older we get, the higher our risk of having atherosclerosis and cardiovascular disease. But certain racial groups, particularly African Americans, are at high risk of heart disease and stroke. And sex differences. Men, I think, are the weaker sex. They have the highest rate of cardiovascular disease in midlife. And then they leave the earth, leaving you women here to suffer the consequences sometimes and be alone. Women, though, catch up later in life and also increase their risk as they get older. But men are earlier in life tend to have more heart disease. And then smoking. You all know that, I'm sure. Kidney dysfunction. And finally, genetics or family history. I often say you should choose your parents well. I'm not sure you know how to do that yet. But if your parents or your brothers or sisters or close relatives have had cardiovascular disease early in life, then you have a higher risk of having it. It doesn't mean you're going to, but you have a higher risk of having cardiovascular disease, and you need to be extra specially careful. Now, all of you have probably exceeded that risk, because once you get over 65 or so, that risk is less important. Okay. So how does your doctor sort of sum all this up? And you mentioned your 10-year risk. Well, doctors use these cardiovascular risk scores to figure out what your risk is of having a heart attack or a stroke or other bad event. And here's just one example. When the doctor's sitting there in front of his computer or her computer, they can put in these various pieces of information. Your age, as you hopefully can see here on the top left, whether you have diabetes, your blood pressure, your cholesterol level, your ethnicity, and whether you smoke or not. And then they press the button, and out comes your cardiovascular risk score. And here, you can see this person has a risk of coronary heart disease of 33%. 1 in 3 chance of having a heart attack. That's a pretty high risk. And you can see that it's in the red zone here in that particular chart. Dying from a heart attack is also a high risk for this particular person. Having a stroke or a fatal stroke is less. They're in the green zone for strokes. So this is the way your doctor can communicate with you about your particular risk. Unfortunately, many of these risk scores don't include people over age 75 because they just assume that you're at high risk if you're over 75. I don't buy that. I think we need new scores for people over 75 because as all of you probably have proven, it doesn't mean that you're going to have a heart attack or a stroke if you're over 75. So we need better scores. But we can still use these to compute somebody's general risk. Okay. So another concept I want to get across to you is the difference between primary and secondary prevention of cardiovascular disease. Have you heard those terms? Primary versus secondary? Well, primary prevention means that we want to prevent you from developing cardiovascular disease in the first place. We want to prevent a first heart attack, a first stroke, first heart failure, or first evidence of vascular disease. It means you're healthy now, and we want to keep you that way. And this is what the Healthy Aging Initiative is all about. It's trying to identify your particular characteristics and give you information ultimately about how you can stay that way, how you can stay as healthy as possible. But we're also interested in secondary prevention. That is, if you've already had a heart attack or already had a small stroke, we want to prevent another one. That's equally, if not more important, because that second one, could kill you. So that's called secondary prevention, to prevent secondary events or to exacerbate or make worse your existing cardiovascular disease. And we can do a lot about that too. We can prevent second heart attacks, strokes, and other vascular conditions. We can prevent the progression of cardiovascular disease. And we'll talk about how we can do that. Okay? So how do we do all this? So now we know what risk factors are, and we know we can create a risk factor score, and we know we want to prevent you from having a bad event like a heart attack or a stroke. So what can we do? Well, shown on this slide is an easy way to remember life's essential 8. These are the things everybody needs to do to prevent cardiovascular disease. And it's in a picture format, and hopefully you can understand what each picture means. So if we start with the green up here, this is diet. We can optimize our diet to prevent cardiovascular disease. And I'll get into each of these in a few minutes. What's this one in blue? Exercise, right. This one's a little obscure. This is diabetes, preventing diabetes. This is just a finger stick, a glucometer, and it's how you can check for diabetes. What's this orange one?
Weight.
Weight, exactly. Weight loss is sometimes important. And this one says lipids. What's lipids?
Cholesterol.
Fat or cholesterol, exactly. This blue one is blood pressure. Don't smoke. And this last one is
Sleep.
sleeping, exactly. That's a
What
new
was the
one.
other one? What was the last you just said?
This one in, what color are you talking about? This one here? What is that?
After blood pressure.
After blood pressure is smoking, no smoking.
Oh, yeah.
Yeah, you know that. And sleep is a relatively new one because research has begun to show that too much or too little sleep are not so good for you. So you want to keep on the same pattern you've been in all your life if you can. And that's a challenge, but we can talk about how to do that. So let's look at each of these. The first was nutrition and diet. We now know that diet has a profound impact on our health. And the best diets are like the Mediterranean diet, like the people in southern Italy and Spain. Those are pretty good diets, right? I love Mediterranean diets. They are full of vegetables, fruit, legumes, nuts, whole grains, and fish. These are health foods. You can see here on the right an example of the pyramid. On the basis of that pyramid is physical activity, but here are breads and a variety of foods that have fiber in them. Too much carbohydrate in bread is not good for you, but those that have a lot of nuts and grains and fiber are good for you. They're good for your bowels, they're good for preventing cancer, and they're good for preventing heart disease. Next are vegetables. Certainly all the green leafy vegetables are good for you, but really any vegetables. Up above that are fruits. Actually, fruits are also part of the vegetable line. Above that are oils. People used to think we should have no fat whatsoever in our diet. No, we need fat in our diet. Fat gives us energy, but only certain types of fat. What's the best type of oil or fat?
Olive oil.
Olive oil. That's called monounsaturated saturated fat, saturated fat, and that's the best. What's the worst?
Water.
Butter.
Saturated fat, things like, you know, butter and thick Crisco oils, things of that sort. Also on this, of course, are fish and poultry, and on the top, small amounts of red meats and very small amounts of very sugary foods like desserts that have lots of cream and sugar.
Certain what? What was the last one?
The last one are desserts with cream and sugar. We want to reduce
the
those.
wonderful things.
I know, the things we like so much. Well, you can have a little bit of those, but by no means,
So what is a little bit?
well,
What's a small amount of meat, for example, or a small amount of sugar? What does that mean?
well, that's a really good question, and it varies in different recommendations. But generally, we want to reduce red meat to maybe 1 or 2 meals a week. We want to reduce a dessert to a small portion, like a cookie, but not every meal. You know, to have a cookie every day, a small cookie after supper, for example, that's fine, as long as the rest of your diet doesn't have a lot of sugar and fat in it, and saturated fat. And you can actually make cookies and cakes and things more healthy by using, instead of oils, you can use applesauce in some of these things. Instead of egg yolks, you can use egg whites. And so there are ways of cooking to make things healthier and less filled with saturated fat and unhealthy foods. So the second bullet on this slide basically reiterates that point. You want to avoid saturated fats and trans fats. And these are the things that are usually in cakes and cookies and ice cream and heavy creams, and the trans fats in all of these processed foods and things that you get in McDonald's and fast food stores. You want to look for monounsaturated and polyunsaturated fats, and as I've written here, olive oil is the best. So I know these are hard to read, but you should get in the habit, if you can, of reading food labels. How many of you actually read the food labels? Good for you. Well, that's why you're here and so healthy. Yeah, this is just an example of a food label, and it can be very confusing. It talks here on the top of the total number of calories, and I wouldn't worry so much about the number of calories, but what's in those calories. And that's what's shown underneath. So here the 220 is per serving, and the 440 is per container. So in this particular example, let's see if I can get the pointer. This particular product, I don't know what it is, but it has 220 calories per serving, and 5 grams of those calories come from fat. That's not so bad if it's olive oil, but let's see what it is. 2 of those grams, or 10%, come from saturated fat. Well, that's not so good. I mean, if it's the only saturated fat you have in a day, that's okay. But if everything you eat has, that many grams of saturated fat, that's a lot. Trans fat is 0, so that's good. Cholesterol is 15 milligrams, that's actually a very low amount. Sodium is important. Sodium is salt. This has 240 milligrams, which is a lot, that's right. You generally want to stick around 2 to 3 grams of salt in a day. This is a quarter of a gram. So this is like 1/8 of the total that you need in a day. That's a lot just for this little package of whatever this is. So that's a lot of salt, and you need to think about that, particularly if you have high blood pressure. And then the dietary fiber, this is 35 grams of carbohydrates, 6 grams of dietary fiber. That's pretty good. And then 7 grams of sugar is getting up there. So this has a lot of sugar and some saturated fat and sodium, so it's not as healthy as it should be. If it's a one snack, if that's your dessert, that's okay. But if you ate everything in a day that has this composition, it's not so good.
How do you decide that 1 cup of this item is the serving versus half a cup or 2 cups of whatever?
It
How is
says
that
usually on the
decided?
container, a serving is, like if this is cookies, 1 or 2 cookies, it'll tell you what it is.
I know, but how do they just determine that serving size is 1 cup in this particular thing?
Yeah, that's a good question. I don't know.
Who decides that?
The company.
The company, I guess,
They
decides.
burn it, count how much heat it produces.
Hmm?
Well, that's, I wish it were that scientific, but I'm not sure it is.
I didn't hear you, what'd you say?
He said it's wrong, so never mind.
Okay.
It's probably marketing. You have a pack of cookies and you want to sell the whole pack and you want everybody to buy them frequently, so they probably
So this is
decide
all
the
by
serving.
marketing, not by dietitian and health people that determine
You're
portion size?
probably right. That's probably correct. Yeah.
Do you have any recommendations for how much fiber you should be taking?
Questions at the end?
Well, question is recommendations for how much fiber. You probably need about 10 to 20 grams of fiber every day. I would have to ask a nutritionist exactly what the latest guidelines are, but you need a fair number.
As a follow-up to you, would it be possible to have a nutritionist talk to us?
Of course.
Maybe, people who could give us advice on cooking and some.
Yeah, we
staples?
actually, Courtney might be
Yeah.
willing to do that. We actually, I
Good
thought,
suggestion.
we'll do that, yes. I think she's giving some talks anyway.
She is.
Okay, so we want to reduce cholesterol and sodium in your diet, and one way to do that is also to minimize processed meats, sugar, and sweetened beverages. People don't realize how much salt and fat are in processed meats, bologna, salami, corned beef, all that stuff that's processed, hot dogs, terrible because it's all fat and salt. So you want to do, natural products. Fish and chicken are best. Red meat's okay, a couple times a week, that's all right, but stay away from things that are processed. There's a lot of sugar in things we eat, particularly Coke and all of the soft drinks and juices, so try to get low sugar products. I love a glass of wine, great, I like beers, but that has a lot of sugar and carbohydrate. I'm sorry?
Wine has a lot of sugar?
Yes, wine has a lot of sugar in it. And sometimes just reducing 1 glass of wine can help you reduce weight significantly, because it does contain sugar. So keep that in mind. Well, I think everybody knows that if there is one intervention that'll cure everything that ails you, it's exercise, right? The only problem is getting human beings to do it is a real problem. But we know now that we need to get about 150 minutes of exercise a week. That can be 30 minutes a day for 5 days. It could be 20 minutes for 7 days. And it doesn't have to be in a gym. It doesn't have to be all at once. It can be broken into short bouts. So you could have, 10-minute walk. Do that 3 times or in the course of a day, and you've got your 30 minutes. Or you could go swimming, or you could do biking if you have a gym or a pool. But you could walk through the halls, and I'll bet if you carried a little pedometer or your little Fitbit, you probably cover about 30 minutes a day if you pay attention to your walking. Remember, any exercise is good. The best exercise is the exercise you will do. So you don't have to go to a gym, whatever you like. And most people like walking. And even if you have arthritis or can't walk long distances, break it up. It's okay. You can break it up into 3 times a day for whatever you want. Try to mix aerobic exercise, which is good for the heart and the cardiovascular system, with some weightlifting exercise, which is like leg lifts or resistance. And I'll give you some examples. Again, you don't have to go to a gym. I like leg lifts a lot because you can just be sitting in a chair like this. And with a heavy shoe, you can just lift your leg, count to 3, put it down, do it on the other side, count to 3, put it down, do it 10 times on each side, and you've got your weightlifting exercises. If it's easy to do that, You can go to the sporting goods store and get a little, what's called a little weight. It has Velcro on it. You strap it around your ankle, and you can lift 1/4 pound. You can move it up to 1/2 pound, 1 pound, 2 pounds, whatever is comfortable. But doing that maybe 3 times a week can really help build the strength of your thighs and butt, and that helps you stand up, walk, climb stairs, and prevent falls. So that's a really good exercise to do. Here are some examples of different intensities of physical activity. Most of us are pretty sedentary. We like to sit, we like to lie down, we like to watch television. That's sedentary activity, and it's okay, but not all day long. We want to mix it up with some light activity, which is like walking slowly, cooking, light housework. That's great, that's exercise. Moderate exercise is brisk walking, biking, dancing, yoga, or even swimming if you have the opportunity. Vigorous exercise is jogging or running, biking, tennis, swimming laps, pickleball. I don't know if you have a pickleball court here, but everybody in Florida is doing pickleball.
Which walk in a chair fit into that? You know, not a slow walk, but a medium walk. Where's that fit in there? Walk in a
What do you
chair.
mean rock? What do you
Walk in a chair. You know, sit in the walk in a chair, walk in a chair.
Well, that's light. That's pretty light.
So that's considered a light one, not sedentary,
I think
okay?
that's pretty light. All right, so you want to get moderate exercise, which is walking, and I think 150 minutes a week is not asking too much. Okay, maintain a healthy weight. Have you heard the term body mass index?
Yes.
Yeah, so this is what doctors use to determine whether you have a healthy weight or not. And the way they calculate it is your weight, but measured in kilograms, divided by your height in meters. So most people are, healthy people might be 70 kilograms and, 70 or so, or meters in height. I think meters.
Hard to get in the room.
3.5, 4 meters in height. And you can just divide it up. You take weight over your height. I didn't write height squared, kilograms per meter squared, so I'll put that in my slides. Anyway, they can calculate it, and usually your BMI ranges from anywhere around 18 all the way up to 40. And here's a little chart on the bottom right, you can see my arrow here, that gives 4 different categories. And I'm going to show you the column on the right, which is the range for older adults. So if you're less than 23 as a body mass index, you're pretty light, and you're probably at risk of malnutrition. You may not be eating and nourishing yourself well enough. The optimal range is between about 18 and 25 for a healthy young person, 23 to 30 for a healthy older person. And if you're over 30, that suggests that you're bordering on overweight or obese, and that's unhealthy. So the two extremes, too little or too much, are not healthy. You want to be somewhere in the middle, between, I'd say, about 25 and 30. And looking around the room, I'll bet most of you are probably in that range. So ask your doctor, what's my BMI? Is it a healthy range? And if it's too much, you want to reduce a little bit. And if it's too little, you want to think about why. Are you not getting the nourishment you need? Could there be an underlying disease that's causing you to lose too much weight? So if you're overweight, you should work with a dietitian, a counselor, or a physician to try to lose weight. And it may be as simple as cutting out one thing in your diet. That extra cookie, that wine, that glass of wine can sometimes make the difference. You're the one that didn't know that wine was it. So who's the cookie person?
That's gotta be me.
Yeah, that's you. It's hard, we all enjoy these things, and we should enjoy things. I'm not saying stop it all, but I think we want to do things in moderation, which is obvious. There are weight loss medications and surgery for people who are obese. These medications are promising. Some of them are very exciting. Wegovy is one of them, and Wegovy and a number of others. But But we have to be careful because they haven't been well tested in older adults. They have a lot of complications. And right now, the medicines on the market for weight loss also cause you to lose muscle. And it's okay to lose fat, but you don't want to lose muscle. So we have to be very careful with some of these medicines. And surgery, I think I would avoid, in older adults, because, any surgery can be dangerous. And if you don't need it, I
You
wouldn't.
talking about like gastric bypass, that kind of stuff?
Yeah. Okay. Cholesterol. What's high cholesterol? Well, it keeps changing over my course of my career. It used to be okay to have a cholesterol of 240 or greater. Now 200 is too high. And we look at the LDL, or the low density cholesterol, which is called the bad cholesterol, because we know that's really responsible for heart disease. And here is a chart that talks about the different LDL, or low density levels. And you want to be preferably below 160 or so. If you have heart disease, you want to be below 130. So remember, cholesterol is not all one thing. There are different types of cholesterol. What's the good cholesterol, do you know?
HDL.
HDL. So here in this little picture of an artery to the right here is an artery with all the cholesterol, that yellow stuff. The LDL deposits cholesterol in the arteries. HDL extracts it. So we want to have a pretty good HDL and a low LDL. If you just look at the total cholesterol, that's LDL plus HDL. So there's several ways you could have total. So if your total is 200 and your HDL is 10 and your LDL is 190, that's bad. But suppose your total cholesterol is 200 and your HDL is 100 and your LDL is 100, that's great. So when you talk to your doctor, you don't want to just talk about the total. You want to ask, well, is the total all good cholesterol, in which case that's a good thing? Or is it a combination of LDL and HDL, in which case, how much LDL and should we get that down? If you want to reduce your cholesterol, your doctor often gives you a medication called a statin. And there are lots of statins: atorvastatin, rosuvastatin, simvastatin. One second. And those can all reduce your cholesterol, and they have different potencies. The strongest ones are rosuvastatin, called Crestor, or atorvastatin, called Lipitor, and they are now being recommended for everything, for primary prevention of heart disease and for secondary prevention. If you've had a stroke or heart attack, we really go gangbusters and give you a lot of a statin. Sometimes the statins can cause muscle pains, so the doctors who give it to you should be checking your muscle enzymes and your liver tests to make sure it's not causing any adverse events. So I saw a question here, yeah.
About side effects. I know that there are a lot of side effects. What's your opinion about, what's the trade-off?
Well, the side effects of cholesterol-lowering medicines, you mean? Is that what you're referring to?
Sorry?
The side effects of cholesterol-lowering medicines, of statins?
Yeah, Crestor and all that stuff.
Yeah, they can have side effects. As I said, most of them can be muscle pains and liver problems. If they develop that, you need to stop that medicine, but you can switch to another one, and sometimes those are better tolerated. There are different brands and different types, and then there are new medicines on the market, Estimib and others that actually work also to reduce your cholesterol. So you got to play around with those that work best, but most of the time people tolerate them quite well. Sometimes you don't. That's just the luck of the draw, but most of the time they're tolerated.
So do the statins work on lowering the LDL, or does it affect the LDL and the HDL?
They mostly lower LDL. They can lower HDL a little bit, but it's mostly the LDL.
We have a question over here. Jen?
Yeah,
The comment that sometimes losing weight is enough to reduce your cholesterol.
absolutely, yes. Losing weight and exercising, yeah, can also reduce cholesterol. So that's the first thing you want to do. And diet, of course.
Well, that's how you lose weight.
Well, that's right.
Can we use a microphone when
I can also repeat the question. Yeah, the comment was that losing weight is also a way of reducing cholesterol. And that's,
Losing cholesterol?
losing weight can also reduce your cholesterol.
Yeah.
So here are some just examples of high cholesterol foods, which I think we've covered pretty much, but they include full-fat dairy foods like things with cream. We all like ice cream, but sometimes you can get low-fat and it's just as good. But every now and then it's all right. Red meat, as I said, every now and then it's all right. Processed meat, fried foods, baked goods, and sweets. Egg yolks are high in cholesterol, but they also have a lot of protein and really good minerals. So an egg yolk every now and then is okay. You can have an egg 2 or 3 breakfasts a week, but not every day and not with a lot of pastries and cakes and things that have egg yolks in them. And if you're cooking for yourself, you can use egg whites, and they don't have any cholesterol. Here are just some examples on the right. I won't. So let's shift gears and talk about hypertension. This is one of the most common conditions as we get older, and that's shown in this slide. This is the percent of the population on the vertical axis by age. Men are shown in blue and women in red. And you can see as age progresses, the percent of the population that has hypertension increases dramatically, such that almost 2/3 of men and 3/4 of women have hypertension by the time they reach 75.
Is the age between 45 and 56 on the women catching up to the men in hypertension because of women going through menopause?
Yes, that's right, they begin to catch up, right?
Because of menopause.
Yeah, usually after menopause. So this is common. Don't think you're falling apart and that you're unusual if you have hypertension. Most people do. And we used to think, years and years ago, that hypertension was normal as you got older, and therefore we shouldn't treat it. Erase that from your mind. We know it's dangerous at any age. The older you get, the more dangerous it can be because you're at higher risk of atherosclerosis and stroke and heart disease. So we now know that treating hypertension is really important, and it can actually prevent a lot of cardiovascular illness. So what is hypertension? Well, that also changes from year to year. We now consider hypertension with if you have a blood pressure greater than 130 for the high number, or 90 for the low number. Remember growing up, 120/80 was normal? It's still normal, even if you're over 80. But it's harder to get your pressure down when you're over 80. So we're a little more liberal, and we allow it to creep up a little bit more. But still, we want to get it, if possible, below 130/90. Now, if you have a lot of other conditions and you're on a lot of medicines, we may go for 140/90. We may even let it go up to 150. But it's important to work with your doctor to get it down as much as you can without having adverse effects. So, the top number, the systolic number, is the pressure in your arteries, in your blood vessels, and we measure it here in your blood vessel in your elbow. When your heart contracts, that's the top number. It's a big contraction, increases your pressure. The bottom number, called the diastolic pressure, is when the heart relaxes. And that's the amount of pressure in your arteries when the heart is not pumping. Okay? So we look at both numbers, and we know that hypertension causes heart attacks, strokes, but one thing people don't know is it also causes memory loss. It causes dementia. And we also know that if we treat hypertension, we can reduce the risk of dementia. So you want to do that. There are many causes of hypertension also besides age. Sleep apnea, kidney disease, adrenal disease. So talk to your doctor to make sure that you don't have any other conditions causing hypertension. And remember that blood pressure fluctuates all the time. It bounces around. That's normal for it to bounce around. So you have to take a lot of different measurements. And you have to check it when you're sitting And when you're standing, because sometimes it'll drop when you stand and you don't want it to drop, so you'll get dizzy and you'll fall. So you have to have your doctor check it under different conditions. Sometimes it drops after you eat a meal, so you want to check it before and after a meal. And sometimes it drops after taking medicine. So I generally recommend to my patients that they check their own blood pressure from time to time. Not every day, not every minute, don't go crazy, but occasionally, sitting, standing, before breakfast, after breakfast, before you take a medicine, after you take a medicine, to get a pattern. What is that blood pressure? And then bring that to your doctor to see when you should take medicines and how much to take. Some people think they only take blood pressure medicines when they feel bad. No. Hypertension doesn't make you feel bad. If you have hypertension, you should take medicine every day because you don't know what's going on during the day. You can't feel it. Okay? So if you're on medicine for hypertension, take it as prescribed, which is every day. Question?
How does your heart rate relate to your blood pressure? I mean,
Yeah. How does your heart rate relate to your blood pressure? When your blood pressure goes too low, your heart speeds up to bring it back up. So your heart rate increases your blood pressure. But as we get older, we cannot increase our heart rate to the same extent. You see that in the gym, where they say, well, if you're 80, here's the heart rate you can achieve. It's much lower than when you're 40. So yes, heart rate can help restore blood pressure, but we don't have as much of a heart rate response.
so you're saying if your blood pressure is running lower, your heart rate will go up?
If you were to stand up
Yeah.
and your blood went to your feet and your blood pressure came down for a minute, your heart rate would increase in order to bring it back. But probably most people in this room don't have much of a heart rate response. It may go up 5 beats per minute. A young, healthy person is going to go up 10 beats, 15 beats a minute. But we can't do that. Yeah.
Aside from disease processes, why does blood pressure go up as we age?
Probably hardening of the arteries causes blood pressure to go up as we age. That, when I showed you the stiffness, the cholesterol, the atherosclerosis, that makes it go up. And the narrowing of arteries. If you think about your garden hose, if you narrow the outlet, by pressing your finger on it, it comes out stronger, right? The pressure is higher. And that's what happens, is as our vessels narrow, the pressure going through it becomes greater. And that's what causes it. How do we treat blood pressure? I think we talked about this. Treatment is safe, it's effective in reducing cardiovascular risk, and it might reduce the risk of dementia. But we start with a low salt diet, less than 2 grams preferably, a high potassium diet. We now know that even potassium is good for you. Exercise and weight loss. And things that have potassium in, what has potassium in?
Bananas.
Yeah, everybody knows bananas. What else?
Potatoes.
Potatoes. Potassium potato, right? What else?
Oranges.
Oranges, apricots, broccoli, spinach, things that are good for you, right? Those are all high potassium foods, and you can look it up on the web. There are lots of foods that have potassium. There's a common drug that increases your blood pressure, and those are the anti-inflammatory drugs called NSAIDs. They're also Motrin, Advil, naproxen, Aleve. They actually increase your blood pressure by holding on to sodium in your body. Now, we all take them. If you have arthritis, these are good drugs. They help you feel better, but they can also raise your pressure. So you need to talk to your doctor about whether they're good for you or not, and how to adjust that. Alcohol can also raise your blood pressure. So although we all like a drink every now and then, remember, too much of it can raise your pressure.
Cold medicine can do it too.
Certain cold medicines, yep. Okay, medicines that we use include diuretics like hydrochlorothiazide, makes you pee a little bit more, that's a little bit of a nuisance. blood vessel dilators that actually dilate, make those blood vessels bigger, are drugs like lisinopril, losartan, candesartan. And then calcium blockers also dilate the blood vessels, and a common one is amlodipine. I'll bet many of you are on those drugs. And your doctor or nurse can check your potassium levels and your kidney function while you're taking these medicines, just to make sure that you don't have any adverse effects. All right, diabetes. I'm not going to talk a lot about diabetes. That's a whole discussion in itself. But many people do develop diabetes as they get older. And it's defined as a blood sugar when you're fasting, when you haven't had anything to eat, of more than 126, or after, just during a random measurement during the day, a blood sugar over 200. We also measure a test called hemoglobin A1C to check for diabetes, and that's generally over 6.5% is indication of diabetes. And diabetes is due to too little insulin in your body or resistance to insulin. And the one thing that makes you resistant to insulin is obesity. So if you're too fat, you may have diabetes because the fat does not respond as it should to the insulin. High blood sugar can cause heart disease, strokes, kidney disease, nerve injury called neuropathies, as well as diseases of your eye. And here in that little circle shown here are all the different things that can result from diabetes. And you can see, picture of stroke, heart attack, artery disease in your legs, eye complications. Look, 3 of these are eye complications. Diabetes affects the retina, cataracts, glaucoma. It affects the feet and can cause injury and infection, kidneys, and nerves. So diabetes is a serious condition, and we want to avoid it, and we can by keeping our weight under control and reducing too much. We don't want to have too much sugar in our diet. So it's preventable with weight loss and exercise. And the medications we use now, there are lots of very good medicines for diabetes. It's not always insulin. There are medicines that increase insulin in the body, and metformin is one of them. Many of you might know. But these are good drugs. Stop smoking. Does anybody in this room smoke? Don't want to put you on the spot. Good. We're seeing less and less smoking these days. I'm glad. But many people have been smoking their whole life, and it's really, really hard to stop. But there are ways we can. Counseling, hypnosis, nicotine patches, medications. There are a lot of good interventions nowadays. Yeah?
What about vaping? A lot of the young people are vaping. Is that the same?
No,
effect?
well, vaping is not good for you either. Vaping has all kinds of other toxic chemicals that can get in your lungs. Now, anything that brings these particles into your lungs are not good for you, including Canadian wildfires. That's not good for you either. Not much we can do about it.
Could I ask a stupid question up there? What is vaping?
Do you want to explain what vaping is?
I don't know, but my granddaughter just wrote home and said a lot of the campers are vaping. Sounds.
It's basically electronic cigarettes where you have this huge smoke. Instead of and they have they're much more concentrated amount of nicotine. And they look like a flash drive, and they're a cigarette.
Yeah.
And they put more smoke in the air or whatever than your average cigarette. So you can tell somebody's vaping because of all the extra,
Lots of smoke coming around their face.
more than your usual cigarette or cigar.
So that's a question.
So what side products are from the heating of the nicotine and the other products in the vapors? And they may be causing serious lung problems.
Absolutely.
And you look like an idiot.
Well, you do. Yeah, you're right.
Well, that's
But the other thing that we've learned about smoking is it doesn't only affect the smoker.
Smokes everybody.
It affects passive smoking, affects
Secondhand
everybody.
smoke.
And a lot of people take up vaping because they think it's better than smoking, period. So that's why a lot of people are taking up vaping.
Yeah.
Both
So
are not good.
There are a number of different interventions. It's not relevant to most of you, but there are a lot of different interventions that people can use to prevent or to stop smoking. And finally, I just wanted to make a comment about aspirin. An aspirin a day keeps the doctor away. Well,
Okay.
we used to think that. Low-dose aspirin is very, very important for secondary prevention. Remember I talked about primary and secondary? Secondary prevention is when you've already had a stroke or a heart attack or vascular disease. And taking an aspirin is a blood thinner. It actually it reduces the risk of blood clots. So if you've already had a heart attack, or you have a stent, or you have a stroke, we don't want you to have another blood clot. And taking a baby aspirin, 80 milligrams a day, can prevent that from happening. We used to think that everybody should take aspirin, even for primary prevention, but a recent study called the ESPRIT trial showed us that if you haven't had a heart attack or stroke, taking an aspirin a day does not help you. And the side effects of aspirin are bleeding. So people who take aspirin bruise easily. So if you fall and you hit your head, we worry, we don't want you to bleed in your head. Or if you have GI bleeding, an ulcer or GI bleeding, taking an aspirin can make that worse. So we have to be very careful. That's why I have this little balance here, the scale, because sometimes the benefit is not as much as the risk. So we have to think with our doctors whether or not we should be taking aspirin. But most people with heart attacks or strokes should take
I have a question over here.
aspirin.
He had the question.
Yeah, I have a question.
I have a comment to that question. I
Yeah.
had a bleeding ulcer, so aspirins are out. However, I'm taking Plavix.
So here's a gentleman who admits he's had a bleeding ulcer, and because of that does not take aspirin, but instead he's taking a medicine called Plavix. That's a good medicine that also reduces your risk of blood clots, but can cause bleeding, but it's a different mechanism, so it seems like it's helping you.
Yeah.
And I thought there was another question here.
Yeah, I was just there. I would take an aspirin once in a blue moon if I have a headache.
Yeah, that's okay, but that's a different dose. So the headache dose is 2 aspirins, 600 milligrams or so.
I only take one.
Okay.
And it's psychological.
Well, if it helps your headache, good for you. But we're talking about baby aspirin, which
Yeah.
is just a fraction of that dose.
Yeah. Okay.
Okay?
It's psychological.
Whatever works, use it. Okay, so my take-home messages are these. Eat a Mediterranean diet and minimize the saturated fat in your diet. Try to maintain a BMI less than 30. Exercise 150 minutes per week and remain physically active. Check and treat any high cholesterol, so make sure your doctor checks your cholesterol and treat it if it's high. Statins are pretty safe, except some people do have adverse effects, but most people don't. Check your blood pressure and treat it if it's above 130/90. Check your blood sugar and treat it if you have diabetes. Don't smoke. And try to encourage your neighbors or friends or relatives who do smoke not to, if you can. And if you've had cardiovascular disease, take a baby aspirin and try to get at least 6 to 8 hours of sleep a night. All right, well, I think I killed a whole hour almost, so we have a couple of minutes. But
What happens if you do all these things, everything is good, but you still have very low blood pressure? Really low blood pressure?
So if you, the question is, if you do all these things and have very low blood pressure, what do you do? Well, it depends. If your blood pressure is too low, that you're dizzy and you're fainting, that's a problem. So then we have to give you things to increase your blood pressure. And the one thing we would give you to increase your blood pressure is salt. So here I'm telling you, reduce your salt if you have high blood pressure, but if your pressure is too low, you need salt and fluids. One of the other things, it's a different talk, but one of the things that we tend not to do as we get older is we don't drink enough fluid. Good reason. First of all, our sense of thirst isn't the same. And also, we don't want to pee so much. That's a nuisance. But if you don't drink enough fluid, you get dehydrated, particularly on days like this, and then your blood pressure goes low, and then you faint or you fall. So drink, drink, drink. On days like this, you need a liter and a half, a quart and a half of fluid, that's 6 glasses at least. So be sure, and you can have it early in the day when you're near a bathroom, and you can reduce it a little bit later, but boy, these days are tough, and you need to drink. Any other questions? Yeah, okay.
We had an emergency here a few weeks ago, and I noticed both the firemen and the EMC kept on asking the person if they were on a blood thinner. And I just wondered if they were asking that because they were afraid the person might have had a stroke, or, they were afraid of injury or bleeding. Why are they focusing so much if you're on a blood thinner? And if you're on a blood thinner, you wouldn't be taking those aspirin.
Well, no, aspirin is a blood thinner. Sometimes you're taking aspirin and another blood thinner. Sometimes you're taking Plavix and an aspirin, or Eliquis, or what, right, exactly. So, I don't know the circumstances, but I suspect that the reason they were called was because the person fell, and they might have been concerned about bleeding in the brain, or in a fractured site, or somewhere else. And they didn't want to, you know, they would have a different emergency procedure if they were concerned about bleeding someplace.
The one thing that made me aware of that is that, I know, that we all should have like those little notes that have what our medicine
Yes.
is and all that. I mean, we should all have it with us all the time.
Well, some people on medicines like blood thinners do carry a bracelet or a necklace that says, you know, it has a little warning, a red warning sign that says taking a blood thinner. That's a good idea. And, you know, a necklace is concealed. I mean, you can wear it, you know, inside your clothing, or you can have a bracelet. But I think that's a good idea. And certainly carry all your medicines in your wallet or your purse, a list of them, so that if something, God forbid, should happen, somebody can look at your wallet and get your medications out.
A lot of people have those medical things that you press the button.
Right.
And I know a few people who saved their life, literally.
Absolutely, yeah, an alert, a falls
Yeah, an alert,
alert
yeah.
that says, yeah. It's a good idea, particularly if you have a tendency to fall. All right, yeah, question?
Is this an ongoing study?
Oh, that's
Yeah,
me.
so I think that's a good segue into a discussion of the study.
Thanks,
Thank you
Dr.
so much for your
Smith.
attention and your good question. I'm gonna turn that
Yeah.
question over to Maggie, maybe we can turn the light